receiving their COVID-19 vaccines. During my career, I have never seen the global health community come together as it has to address COVID-19. The pace of scientific advancement and innovation on all aspects of the response has been truly remarkable. This international cooperation has enabled the rapid development, review, and distribution of vaccines at an unprecedented rate, while at the same time safeguarding the review process to ensure safety and efficacy. The focus of today's briefing will include further details on our plans for the distribution of the COVID-19 vaccines to Canadians, and we'll talk about what we've learned so far. Things are happening quickly, and communication and information are crucial. Just as we are engaging with you, members of the media, to reach Canadians with information they are seeking now, we are also engaging with healthcare providers using trusted sources of information. For example, the Public Health Agency of Canada is developing a series of webinars about the COVID-19 vaccine candidates to prepare healthcare providers to answer patient questions. As the Pfizer vaccine is rolling out, we are now preparing to receive and, pending authorization, roll out early doses of the Moderna vaccine. This is especially good news for remote locations where the demanding logistics requirements pose unique challenges for equitable access. When Canada authorizes any vaccine, Canadians can be confident that the decision is the result of rigorous regulatory review for quality, safety, and efficacy, for which our country is widely recognized and respected. I want to take this opportunity to remind Canadians that we are not at the end of living with COVID-19, rather, we are at the beginning of the end. As welcome as news of a first vaccine for Canadians may be, it is crucial for Canadians to continue following the guidance of their local public health authorities and to keep up with individual public health practices to protect ourselves, our families, and communities. The vaccine offers protection against disease, but studies are still underway to assess the vaccine's ability to prevent transmission. As the number of COVID-19 cases continues to increase nationally, we must remain steadfast. These developments on the vaccine front bring hope that we are on the road to ending the pandemic, and we thank provincial and territorial governments, Indigenous leaders, industry, and all the people of Canada for your ongoing collaboration and commitment to managing COVID-19 and to the rollout of the COVID-19 vaccines. Before opening the floor to questions, my colleagues will say a few words. First, Major General Fortin, who will elaborate on the delivery of the Pfizer vaccine and what the subsequent rollout of larger quantities of COVID-19 vaccines will look like. And then Dr. Adams and Dr. Wong will talk about how we are engaging with Indigenous organizations to reach decisions that will impact vaccine rollout in their communities. Bonjour à toutes et à tous. Good afternoon. Je vous remercie de votre présence.
Thank you all for being here.
Je suis de nouveau accompagné
Again, I'm here
aujourd'hui de
today
Major Général
with
Denis Fortin,
Major General Denis
vice-président de la
Fortin,
logistique et
the
des opérations
Public Health Agency
à
of
l'Agence de la
Canada's
Santé
Vice
publique du
President
Canada
of
pour le
Logistics and
déploiement
Operations
de vaccins
for the
contre la
rollout
COVID-19
of
au Canada.
COVID-19
Et le Dr.
vaccines
Tom
in
Wong,
Canada.
médecin hygiéniste
Also,
en chef,
Dr.
Santé
Tom
publique,
Wong, Chief
Service
Medical
aux
Officer of
Autochtones
Public Health
Canada.
at Indigenous
Le
Services
Dr. Evan
Canada.
Adams, médecin hygiéniste en chef adjoint,
Dr.
Santé publique,
Evan
Service aux
Adams,
Autochtones
Deputy
Canada,
Chief
est avec nous
Medical
par
Officer of Public
vidéoconférence.
Health at
Nous avons
Indigenous
également
Services
le Dr.
Canada
Marc
by
Bertillon,
video conference.
directeur des
On the
sciences
line, we
médicales
also
de
have
Santé
from Health Canada,
en
Dr.
ligne.
Marc Bertillon,
Madame
Director of
Ariane
Medical
Reza,
Science,
sous-ministre
and Ms.
adjointe,
Ariane Reza,
représente la Direction
Assistant Deputy
générale
Minister
de
from
l'approvisionnement,
Procurement,
Services publics
Public
et
Services
Approvisionnement
Canada.
Et d'innovation,
And from
sciences et développement
Innovation,
économique
Science
Canada,
and Economic
Madame Colette
Development
Kaminsky,
Canada, Ms.
Directrice
Colette
générale,
Kaminsky,
Fonds
Director
stratégique
General,
pour l'innovation.
Strategic Innovation Fund. We are all available to answer your questions. It's been another important week in our vaccine rollout, with the first doses of the Pfizer vaccine arriving in Canada. On Monday, we heard the news that we've been waiting for. Canadians have started receiving their COVID-19 vaccines. During my career, I've never seen the global health community come together as it has to address COVID-19. The pace of scientific advancement and innovation on all aspects of the response has been truly remarkable. This international cooperation has enabled the rapid development, review, and distribution of vaccines at an unprecedented rate, while at the same time safeguarding the review process to ensure safety and efficacy. The focus of today's briefing will include further details on our plans for the distribution of the COVID-19 vaccines to Canadians, and we'll talk about what we've learned so far. Things are happening quickly, and communication and information are crucial. Just as we're engaging with you, members of the media, to reach Canadians with information they are seeking now, we are also engaging with healthcare providers using trusted sources of information. For example, the Public Health Agency of Canada is developing a series of webinars about the COVID-19 vaccine candidates to prepare healthcare providers to answer patient questions. As the Pfizer vaccine is rolling out, we are now preparing to receive and, pending authorization, roll out early doses of the Moderna vaccine. This is especially good news for remote locations where the demanding logistics requirements pose unique challenges for equitable access to vaccines. When Canada authorizes any vaccine, Canadians can be confident that the decision is the result of rigorous regulatory review for quality, safety, and efficacy, for which our country is widely recognized and respected. I want to take this opportunity to remind Canadians that we are not at the end of living with COVID-19. Rather, we are at the beginning of the end. This week marks the first vaccinations of Canadians, the first mile of this marathon. We have trained and prepared for success, and we have done so as a team. But to be a team, we have to act as one. So while we continue to pass each mile marker of this marathon, it's crucial for Canadians to continue to follow the guidance of their local public health authorities and to keep up with individual public health practices to protect ourselves, our families, and communities. We need to do this until we all cross the finish line together. We know the Pfizer vaccine offers protection against the disease, but studies are still underway to assess the vaccine's ability to prevent you from transmitting the virus to someone else. And as the number of COVID-19 cases continues to increase nationally, we must remain steadfast. These developments on the vaccine front bring hope that we are on the road to ending the pandemic, and we thank provincial and territorial governments, Indigenous leaders, industry, and all the people of Canada for your ongoing collaboration and commitment to managing COVID-19 and to the rollout of COVID-19 vaccines. Before opening the floor to questions, my colleagues will say a few words, beginning with Major General Fortin, who will elaborate on the delivery of the Pfizer vaccine and what the subsequent rollout of larger quantities of COVID-19 vaccines will look like. Dr. Adams and Dr. Wong will then talk about how we are engaging with Indigenous organizations to reach decisions that will affect vaccine rollout in their communities. Major General Fortin, you have the floor. Thank you very much, Dr. New.
Our collective efforts to bring the initial shipments of the Pfizer-BioNTech vaccine to Canadians has been a success, and the first deliveries went exactly according to plan. The National Operations Center at the Public Health Agency had positive in-transit visibility on each shipment. The level of cooperation between Pfizer-BioNTech, the logistics service provider, UPS, and the Canadian Border Service Agency was excellent throughout. More shipments of the Pfizer-BioNTech vaccine are coming in the weeks and months ahead, as announced earlier. Provinces are scaling up, moving to scale up to around 70 points of use based on vaccine availability and their individual immunization strategies. Additional ultra-low temperature and points of distribution are being added to the cold chain to allow the Pfizer-BioNTech vaccines to be administered at more points of use, and thousands more people are being trained to prepare and administer the vaccine. Let me move on to the next planning effort that's now underway. We're taking deliberate steps to ensure the safe and efficient distribution of the Moderna vaccine candidate across the country, including our Indigenous communities, once Health Canada has completed the regulatory review process. This past weekend, 5 -20 freezers procured by the Public Health Agency of Canada were delivered by the Canadian Armed Forces to our territories. These freezers will support the cold chain requirements for the Moderna vaccine and build the capacity of territorial health organizations to immunize people within their jurisdiction. Provinces and territories already have the ancillary equipment in their possession, including all the needles, the syringes, the different protective equipment on hand for the first quarter of 2021. A dry run is ongoing, similar to what we did last week, to confirm the ordering, the importation, and shipping processes for the Moderna vaccine. The rehearsals of this nature are part of a deliberate and phased approach to readiness in advance of an authorization decision from Health Canada on vaccine candidates. So we'll deliver the Moderna vaccine to the locations specified by provinces and territories so that they can commence immunization as quickly as possible once it's approved and available. Working with all our partners and stakeholders, we continue to enhance the readiness, meanwhile, build capacity, and develop innovative ways to deliver the vaccines to all Canadians. Nos efforts collectifs pour assurer les premières livraisons.
Our collective efforts to bring the initial shipments of the Pfizer-BioNTech vaccine to Canadians have been a success, and the first deliveries went according to plan. The National Operations Centre at the Public Health Agency of Canada had positive in-transit visibility on each shipment along the entire chain. The level of cooperation with Pfizer's logistics service provider, UPS, and the Canadian Border Services Agency was excellent. More shipments of the Pfizer-BioNTech vaccine are coming in the weeks and months ahead, as has already been announced. Provinces are scaling up, and they'll be adding up to another 70 points of use based on vaccine availability over the coming weeks and based on their individual immunization strategies. These additional points of use will come on top of the ultra-low temperature points of distribution. They're being added to the cold chain to allow the Pfizer-BioNTech vaccines to be administered at more and more points of use, and thousands more people are being trained through the Public Health Service Agency of Canada to prepare and administer the vaccine. So, moving on to the next major efforts within the agency for the rollout. We're taking deliberate measures to ensure the safe and efficient distribution of the Moderna vaccine candidate across Canada, including into our territories and other isolated and remote communities, should it be authorized by Health Canada. This past weekend, 5 -20-degree freezers procured by the Public Health Agency of Canada were delivered to the territories. These freezers will support the cold chain requirements for the Moderna vaccine and build the capacity of territorial health organizations to immunize people within their jurisdiction. Provinces and territories have enough ancillary supplies of needles and syringes, gauze and alcohol swabs. They have all these things on hand for the first quarter of 2021. We have commenced a dry run, which is similar to the one we did last week. So a dry run with Canada's vaccine logistics service provider for the Moderna vaccine. And this type of rehearsal is part of a deliberate and phased approach to readiness, as I've already said, in advance of an authorization decision by Health Canada on a vaccine candidate. So we are going to deliver the Moderna vaccine to places identified by provinces and territories so they can start administering that vaccine as soon as the Moderna vaccine is approved and available. In collaboration with all of our partners and stakeholders, we're continuing to enhance readiness and build capacity and develop innovative ways to deliver the COVID-19 vaccines as quickly and as safely as possible to all Canadians. With that, I will give my colleague the floor to my colleague.
Acknowledge that I'm speaking to you from Tla'amin Territory near the city of Powell River, BC. As of December 15th, a total of 6,390 First Nations on-reserve COVID cases have been reported, with 2,472 being active. To date, 50% of First Nations communities in Canada have experienced COVID. In particular, we are seeing alarmingly high numbers of Indigenous cases in Alberta, Saskatchewan, and Manitoba. And sadly, there have been 55 on-reserve fatalities. We must do everything we can to protect Indigenous communities, particularly our elders, from COVID-19. We need to listen to the evidence-based advice of the National Advisory Committee on Immunization about the need to prioritize frontline healthcare workers, long-term care home workers and residents, and seniors, together with Indigenous peoples who might be disproportionately impacted by COVID-19. First Nations, Inuit, and Métis have worked diligently to control the spread of the virus in their communities. We acknowledge their strength and resilience and the hard work they continue to put into leading their communities to safety. It is imperative that First Nations, Inuit, and Métis be partners with provinces and territories in the co-planning for culturally safe and equitable vaccine access in both rural and urban areas. We are working closely with Indigenous leadership. Minister of Indigenous Services Canada, Mark Miller, and his staff have met with leadership from the Assembly of First Nations, Inuit Tapiri Kanatami, and Métis National Council to hear their issues related to the vaccine rollout in Indigenous communities. We are engaging Indigenous communities directly through the formation of the COVID-19 Vaccine Planning Working Group, where federal, provincial, territorial, and Indigenous partners can explore vaccine rollout in every province and territory for all First Nations, Inuit, and Métis peoples. Vaccines will be delivered to Northern and Indigenous communities once it has received regulatory approval from Health Canada, and a decision is expected soon. We acknowledge the unique circumstances of individual First Nations, Métis, and Inuit communities, and their unique service relationships that often involve Indigenous Services Canada, provincial and territorial public health, and of course, staff in Indigenous communities and their leadership. We are taking deliberate steps to ensure the safe and efficient distribution of the Moderna vaccine candidate across Canada, especially into the territories, Indigenous, and isolated and remote communities. We need to walk down this path together so that no one is left behind. That ends my comments in English. These will now be repeated in French by my colleague, Dr. Tom.
Bonjour.
Good afternoon. I'd like to acknowledge that I'm speaking to you on Algonquin territory. Since December 15th, a total of 6,390 First Nations on-reserve COVID cases have been reported, with 2,477 being active. To date, 50% of First Nations communities in Canada have experienced COVID-19. In particular, we are seeing very high numbers in Alberta, Saskatchewan, and also in Manitoba. Sadly, there have been 55 on-reserve fatalities. We must do everything we can to protect Indigenous communities, particularly our elders, from COVID-19. We need to listen to the evidence-based advice of the National Advisory Committee on Immunization about the need to prioritize frontline healthcare workers, long-term care workers, and residents and seniors, together with Indigenous peoples who might be disproportionately impacted by COVID-19. First Nations, Inuit, and Métis have worked diligently to control the spread of the virus in their communities. We acknowledge their strength and their resilience, and it is imperative that First Nations, Inuit, and Métis be partners with provinces and territories in the co-planning for culturally safe and equitable vaccine access in both rural and urban areas. We are working closely with Indigenous leadership. We are also working closely with the department. We've met with leadership from the Assembly of First Nations, and we are well aware of the unique circumstances of First Nations, Inuit, and the Métis, and we are taking concrete measures to ensure the safety and efficacy in the distribution of the Moderna vaccine throughout Canada, specifically in the territories, Indigenous communities, and isolated and faraway communities. Now, quickly after, and this will happen right after Health Canada approves the Moderna vaccine. So we are making sure that we walk down this path so no one is left behind. Thank you very much.
We will now open the line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles.
Please feel free to ask your questions in either official language.
Questions in the room, we ask that you make your way over to the freestanding mics. As usual, we'll start with 2 questions on the phone and 2 questions in the room. Operator, over to you.
Thank you. Merci. Please press star 1 if you have a question. Veuillez appuyer sur étoile 1 maintenant pour poser une question. Our first question is from Christy Kirka from the Globe and Mail. Please go ahead. À vous la parole.
Hi, good morning. Thank you for taking our questions. My questions are related to the immunization campaign for Indigenous communities. So perhaps Dr. Adams or Dr. Wong would like to take these questions. I'm wondering, first and foremost, what pool are these vaccines going to be coming from? Is this, going to be from the pool allocated to the provinces and territories, and then it will be up to the provinces and territories to get the vaccines out to Indigenous communities?
Hi, it's Dr. Adams. Thank you for the question. The relationship between Indigenous communities and a vaccine delivery is normally between the provinces with some participation from Indigenous Services Canada, and can vary from primary relationship between Indigenous communities is with their provinces, and so vaccines will be delivered almost certainly directly to the provinces and then distributed outwards from that. But with full collaboration from Indigenous Services Canada and workers on the ground, Indigenous workers who are employed by their communities.
And on that note, it is so important that provinces and territories, we need the help of provinces and territories through their vaccine distribution system and through the vaccine program to support First Nations, Métis, and Inuit in full collaboration and in partnership to co-plan the vaccination and immunization clinic and the campaign with First Nations, Métis, and Inuit, regardless of where they reside. Thank you.
Thank you, doctors. Christy, follow up?
Yeah, and just as a follow-up, I know that Indigenous communities have been identified as a top priority group, as you described it by the committee. Given the fact that the vaccines will be rolled out by the provinces and territories, and I know it will be in collaboration with Indigenous services, but is there any concern that provincial governments or territorial governments will not prioritize Indigenous populations, and how is Indigenous services working to perhaps address that, given some recent remarks by a certain premier from Manitoba?
I think for such diverse entities as the federal government, provincial governments, and their health systems, and then the individual health systems, big and small, that exist in First Nations, Inuit, and Métis populations, it does take some discussion and organizing to make sure that there are no gaps. I feel like those conversations are beginning. We haven't had access to the vaccine for a very long time, but the conversations absolutely have begun between many levels of leadership, and I've been lucky enough to be in many of those meetings, and I think the sense from communities that I'm hearing is that they're excited to participate. They have strong ideas about how this can happen successfully and quickly, and I think there is a lot of thought going into the named priorities and how they can make that happen so that people in Indigenous communities are protected and safe.
We are engaging First Nations, Métis, and Inuit communities directly through the formation of a federal, provincial, territorial, Indigenous COVID vaccine planning working group at the national level, where federal, provincial, territorial, and Indigenous partners can explore together on issues and on opportunities to work together, to roll out the plan together, to co-develop a plan together. And that's what First Nations and Métis and Inuit partners have been telling us and telling the provinces and territories. At the same time, we support provinces and territories and Indigenous partners in each region of the country to be working together, to sit together and plan together for the plan to roll out the vaccine. Thank you.
Thank you, Dr. Zopper. Next question.
Thank you. Notre prochaine question est de l'inaudible de la presse canadienne. À vous la parole.
Question. Hello, my question is for you, Mr. Fortin. Can you remind me of the following? Moderna, does it require that the vaccine be administered at a point of distribution, as is the case with Pfizer, or can Moderna be taken anywhere, basically? When you say that everything unfold exactly as predicted, does this mean that you did not have to make any adjustments to your chain of logistics? Answer. Thank you very much. Well, first, when it comes to the distribution of the Moderna vaccine, well, it will be brought here thanks to our logistics provider, FedEx Innomar, and it'll be brought to points of distribution, and then provinces and territories will be able to redistribute the Moderna vaccine following instructions provided by the manufacturer. And Moderna will be able to be shipped to very far communities as well as throughout urban areas. The exact directives are still to be confirmed because for now this product has to be handled when frozen. So as I've already said, as with the Pfizer vaccine, the Moderna vaccine, as they are finalizing their stability directives, these directives, these shipping directives, we hope will be less restrictive. But as it now stands, the Moderna vaccine will be able to distribute it further past the points of distribution. Question. Thank you. Can you answer the second question I asked? Now, when you said that absolutely nothing changed in your planned rollout when it came to actually rolling out the Pfizer vaccine. And then another question for Dr. New. This might be an esoteric question, but we still don't know whether the Pfizer vaccine will allow people who have been vaccinated to not infect anyone else. So once you've been vaccinated with one vaccine, say the Pfizer one, you stick with that. And if you get Moderna, you stick with that. Answer. Well, thank you for the question. To answer the first part of your question with regard to the risk of transmission once a person has been vaccinated, well, as I said, we're actually analyzing the evidence, the data. With Pfizer's vaccine, all the evidence in the clinical trials show that it is effective to reduce the severe symptoms of COVID-19, but we still need more studies to know exactly whether transmission will be lower from people who have received the vaccine. Now, with regard to getting several vaccines, well, that clearly is a top-of-mind issue. We know that the National Advisory Committee on Immunization is looking at what happens if you get one vaccine the first time and another one the second time. Pfizer and Moderna use the same techniques. That's a scientific issue. And at this point here, we don't have enough evidence to have an answer. But we're keeping up with science, which is still evolving. Thank you. Next answer. I can probably answer the second part of the question you asked earlier. We did not have to adjust our cold supply chain. Everything rolled out just as it did during the dry run. However, I think that in future, might have to perhaps review our processes when greater quantities of vaccines come in. So that might require some adjustments, but as for the first rollout, it worked exactly as we had planned.
First question, CTV.
Hi, Rachel Haynes from CTV National News. My first question would be for Dr. New, I think, about the Moderna approval. I know it's coming soon. Can you give us any hints of when and what specific information is Health Canada still waiting for on its approval?
Okay, so thank you very much for the question. Before I turn it over to my colleague, Dr. Bertillon, I do want to underline the point that from the public health aspect, we're continuing our planning with sort of the planning assumption that the Moderna vaccine will be available. And I know Major General Fortin is also on the logistics operational side working with his provincial territorial colleagues in that regard. But I do want to stress the point that our regulatory system is independent. we have to respect the due diligence and sort of the pace at which they're receiving the data and analyzing it. And I don't think we want to put undue pressure. There's certainly no pressure from us. We are waiting diligently for their decision, and it should be, I think, in the near future. But that's all I will say at this point, and I'll pass it on to Dr. Berthiaume to give you further details.
Thank you for the question. So Health Canada has been reviewing Moderna's vaccine since it was submitted on October 12th, and it is expediting the review of COVID vaccines. This is being done through rolling submissions where data is being reviewed as it becomes available from the manufacturer. Rolling submissions allow for shorter review times without compromising safety, efficacy, and quality as part of the interim order. At this point, there is still information to be provided by Moderna for review, including some quality information. Health Canada cannot provide a definite timeline for the completion of the review at this time, although it is expected to be completed in the coming weeks. And while Health Canada is working hard to give Canadian access to COVID-19 vaccines as quickly as possible, we will not compromise on safety, efficacy, or quality standards, and protecting the health and safety of Canadians remains our top priority.
Thank you, Dr. Berthiaume. Follow-up?
Thank you. My follow-up, I think, is for Major General about Pfizer production capacity. Right now, U.S. officials are saying that they're working with Pfizer after Pfizer informed them that it may be facing production challenges. Is this something that could affect Canada's supply of Pfizer vaccines, or has Canada been warned of any production issues coming from Pfizer?
So we're in conversation with Pfizer on a daily basis, multiple levels. They are still working through the schedule for January. As there's a global demand, it's a global manufacturer, and of course, they have challenges because we're also getting into the holiday period. But we're getting visibility on parts and parcels of that scheduled delivery today. We're continue to work with them and refine this. So I can't really speak in detail about this schedule just yet, January, because we don't have it. But we're all working very hard to get that predictability that we would expect. Even if it's a quantity that is perhaps lower than you would expect if you were to break it down per week over the first quarter, with the expected amount of up to 4 million, we have assurances that we will get the quantity that's been earmarked for Canada, that's been contracted, and the delivery is no doubt going to pan out the way that we intended.
Okay, and thank you very much. I just also give an opportunity for our colleague, Ms. Reza from Public Services of Procurement Canada, if there's any additional comments.
Thank you for the opportunity. I think General Fortin nailed it. We work closely every day with Pfizer and all the vaccine suppliers to look at the notional delivery schedule and to do what we can to secure Canada's allocation timeframe. As we've seen with Pfizer and Moderna, the early delivery for Canada is an excellent sign. Thank you.
Thank you. Next question in the room, CBC.
Hi, Tom Perry from CBC. I've got a couple of questions from my colleagues in Manitoba. They were saying that Manitoba is getting 9,600 doses of Moderna vaccine earmarked for First Nations communities. And the question is, does it make more sense for that vaccine to go into communities where there have been outbreaks to try and get the outbreak under control there? Does it make more sense to go to a community that's held back the virus to sort of better protect it? Is it some combination? What makes the most sense?
I think I'll pass it on to my colleagues at Indigenous Services Canada for that.
Do you want to begin, Tom?
It is, something that extremely important, for us together with the First Nations communities experiencing an outbreak, to have those discussions with the province regarding, their distribution of the vaccine as Moderna comes into Canada. it is, one of, those high priority issues, that we want to put on the table as we meet with, the province together with First Nations in the coming days regarding, their interest, in and their plans to discuss with the First Nations how they would like, to roll out the vaccine. And this is, one among others, including, there's outbreaks in downtown Winnipeg, for example, and not just Manitoba, but in other provinces as well. So those are some of the key issues where you can actually resolve those issues if you actually plan at the same table. Dr. Adams?
Yes, we're very actively discussing Indigenous peoples who might be disproportionately impacted. That can mean those who are underserved, like perhaps in rural and remote areas, but also those where we're seeing outbreaks. So there's definitely some sense in going directly there. However, there are some challenges, just physical limitations to delivery. So some communities might be easier to get to than others. So all of those combined, and with discussion with a number of stakeholders, means that there are some factors to consider before the rollout is finalized. But we're definitely very active in making those plans.
I mean, from a standpoint of just getting the spread under control, does it make more sense to go into a community, say, that's had an outbreak, try and put out the fire there? Or does it make more sense to go to a different community where they've held back the virus, try and protect them to keep the fire from spreading?
It certainly does, make sense about, the need, to contain the virus if there's an outbreak. And it is so important that First Nations, if there's an outbreak in the First Nations communities, First Nations, be the lead, in those discussions together, with the province. And we stand behind First Nations in having those active discussions with the involved province or territory. Thanks.
Thank you, Dr. Wong. We'll turn back to the forum for one question. Operator, next question.
Thank you. Our next question is from Dylan Robertson from the Winnipeg Free Press. À vous la parole, please go ahead.
Hi there. Just further to Christy's question, it seems that Indigenous Services Canada is taking a bit of a kumbaya approach here. You want everyone to talk this out, but some provinces have terrible relationships with Indigenous communities. In Manitoba, the chiefs have boycotted talking with the Premier. The Métis say they haven't had an invite. This information is still current as of last night. So if the Moderna vaccine rolls into the prairies next week and they're not actually talking, does Ottawa have a point at which it just steps in and says, look, you're not getting the full quota if you don't vaccinate these certain groups? And does that stop at the reserve, or would that include Métis people or non-status people?
Dr. Adams?
I think ideally, you can see the sense in collaboration between First Nations, Inuit, and Métis, the provincial government, and the federal government. And it is absolutely our expectation that we would reach agreement on the best way to do this so that people are protected. Our legacy will be that people are safe and done very quickly and done very wisely. And I would hate to consider the worst case scenario where people don't get along or agree not to organize. So I certainly don't feel negatively at this point. I think people want to do their jobs, and I think people see the sense in cooperating and saving lives. So we're very active at the table, trying to make plans, regardless of maybe some public stated positions. Thanks.
First Nations, Métis, and Inuit people have taught us a lot and many things. And, we were taught that we are in the same boat together. If one part sinks, the whole boat sinks. Thanks.
Thank you. Follow up?
Can you please outline how much Moderna quota has been reallocated to provinces? Minister Haidu has confirmed that provinces with large on-reserve populations are getting a boost to their quota. So I just want to know which provinces are losing some quota, which are gaining some quota, and what percentage of the quarter one Moderna doses will be reallocated outside of the strict per capita method.
It's Dr. New. Maybe I'll start off just sort of restating what I've said previously, and then I'll turn it over to Major General Fortin and others for more detail. As I've said previously, certainly for planning purposes, what we're looking at is that we're anticipating getting 6 million doses of vaccine in the first quarter of 2021, and that's 4 million doses of the Pfizer vaccine and 2 million doses of the Moderna vaccine. So that's a total envelope. In the agreement, certainly the understanding and the consensus at the public health tables at which we've had discussions is that it would be allocated to provinces on a per capita basis. Now, what we're looking at from a more of a logistical perspective is the fact that, as we all know, the Pfizer product obviously has more challenges logistically in terms of handling, manipulation, and so on. And the territories, from a jurisdictional perspective, the three territories have indicated that it doesn't make sense for them to accept, quote, their per capita allocation as any proportion being Pfizer products. So if you look at the, 6 million doses, 4 and 2, that's a 2-to-1 ratio. So what the territories have indicated to us is that no, rather than getting a 2-to-1 of Pfizer to Moderna sort of allocation, they would prefer their product to be 100% Moderna. So I think in the spirit of collaboration, what the provinces have also agreed to is that, yes, it makes sense that that the territories receive their allocation as Moderna product, and they would be prepared to take on, quote, a greater proportion, so it'd be more than 2-to-1 overall in terms of getting the Pfizer product as opposed to Moderna. However, then, as you can say, that it then becomes a logistical issue as well, because there's certainly in some provinces that have, quote, northern communities, you could see that at the end of the day, for those communities affected, that there's really not much difference in terms of their reality on the ground, as opposed to, quote, a southern community in a territory. You might be separated by a few hundred kilometers or so. So that's that discussion that's ongoing in terms of finer adjustment. But at the end of the day, it is a per capita allocation. We know what the envelope is, and it's really, I think, at a very practical level that we're trying to now do the adjustments in terms of Pfizer versus Moderna products for each of the jurisdictions. So with that, I'll pass it on to Major General Fortin.
Yes, thank you. I think that we have to remember that we're working with different variables here. And it's a complicated, new products, different, technology, ultra low temperature. In the case of the Moderna vaccine, it's a little bit easier. It's a cold, frozen chain. And we also want to, factor in the difference between shipping to or delivering to urban areas or rural areas, and the the remote, the very difficult access to locations across the provinces and then in the territories. Also mindful that while we have a per capita distribution, it is entirely possible that a particular community gets an appropriate number of vaccines all at once, while others do not until we have the next shipment, only because of the practicality of delivering this over a very large country, sparsely populated in the middle of winter, in places where there isn't even daylight for months. So all of those variables make this a little bit more complicated than the delivery of products in chains, supply chains that are well exercised every year. So very mindful of that deliberate approach to bring this safely to all Canadians and as rapidly as possible, and moving all those the different parts of the puzzle so that it's done as effectively as possible. I think that's probably the cleanest answer I can give you right now.
Thank you, Major General Fortin. We'll turn back to the room. Next question, Toronto Star.
Hi, Tonda McCharles, Toronto Star. I am curious about what is the rollout over a longer period and why Canada hasn't stratified the priority access groups after the immediate first emergency priority access by age, such as Britain has done. Being that Dr. Tam a few weeks ago said to us that that seems to be the way that actually evidence shows it should be rolled out. Can you talk to that?
Dr. New, I could start. If you look at the advice we've been getting from NACI, from our National Advisory Committee on Immunization, you can see that their preliminary guidance was actually broader. So, looking at other essential workers, looking at older Canadians, obviously, I think the priority now has been to in a sense, focus down, but certainly with limited doses in the first quarter, you have to make sort of priorities within priorities. And so that's why we have the 4 groups we're talking about now. But certainly as we roll out further into the spring, the anticipation and planning is that, okay, if we focus initially on, let's say, older Canadians over the age of 80, once we get more doses, then we can focus on the quote, younger Canadians, let's say those over 70 years of age. And then we can also start looking at other essential workers that obviously need to keep our society going beyond, as we just indicated now, the healthcare workers and those that work in long-term care facilities. So I think overall the plan is there. Everyone is recognizing what we need to do in the short term for the first quarter. And as the anticipation for more doses and maybe a larger suite of vaccine candidates becomes available, that we'll be able to roll out to obviously offer it to a greater number of Canadians. And there's nothing magic that happens between, let's say, the end of March and April. As Major General Fortin said, it's drip, drip, and even as we're moving now, where it's becoming a sort of a more widespread in terms of our capability in terms of distributing vaccines.
Thank you. Follow up.
Well, I've heard all those answers to other questions constantly. I guess I'm asking what beyond the short term, how are you organizing the priorities? Why isn't it by age? But if that's not answerable, then can you speak to the discussions around how the vaccine rolls out in Indigenous communities? It seems to me to sort of be very late in the game coming. You talk about the imperative to cooperate. I assume you've been at that, trying to do that. So can you identify what you're finding are the points of friction in these discussions right now? And have the First Nations, Indigenous, the Inuit and Métis leaders, have they all bought into the so-called priorities initially for distribution? Or are they anticipating community-wide vaccination, regardless of whatever groups there might be identified as priorities? Can you speak to sort of points of friction? What's their priority? Why so late?
Dr. Adams.
Thank you. I think from my many discussions with many Indigenous that they're all that there are tough decisions about which part of their populations are priority, and they certainly spend in having their healthcare workers and their elders be at the front of the line. But there is discussion about other aspects of their populations that we have to hear them out about. They're concerned about children who may not be extremely well, about young mothers. Definitely, there's some discussion that starting with over 80 is why not over 65? And definitely, some are saying that, of course, there's risk for remote peoples. They have a lack of service should they get infections. But definitely there's a kind of social risk. Perhaps there are some amongst us who will have a harder time dealing with infection, even if they're living close to cities or tertiary care centers. So it's definitely a lot of conversation. Certainly it would be faster for someone just to call it very quickly, but that is not ideal. And definitely in public health, we always have to keep a balance between individual voices and individual need and the good of the entirety of the population. And it is definitely a balance.
Indigenous partners have been highlighting, just like what Dr. Adams just said, because the life expectancy is shorter in Indigenous peoples, as well as gaps in social determinants of health and underlying medical conditions. For Indigenous communities, Indigenous partners are advocating for, starting at a younger age compared to the general Canadian population. And if you actually look at the First Nations data that's being released by First Nations in Manitoba, you can actually see that the median age, of the fatal cases, they are 15 years to 20 years younger, than the general Manitoban population. That's just, an example. In addition to that, Indigenous partners, are wanting to prioritize and make the decisions on individuals with underlying medical conditions, as well as individuals and communities in more northern, remote, and isolated communities, but also in communities that are socially isolated, from others. They may be not physically, geographically isolated, but the social isolation, including in urban centers where impoverished and underserviced First Nation, Métis, and Inuit may live. And this is, one gap that has been, highlighted. So that's part of the plan that the national working group is working on. And currently there's a draft, plan, being discussed as well. They take the plan to actually go to each region and work with the province or the territories in discussing specifically how to actually identify ways to actually roll out the plan specifically for the communities and for the region, because each region is different, each community is different, but based on the plan that's at the national level. Thanks.
Thank you, doctors. Being conscious of time, we'll take the last question in the room. Globe and Mail.
Thank you, Marika Walsh with the Globe and Mail. Dr. Wong, I'm wondering if you or Dr. New can just be very clear for us, because there's been a lot of misinformation. I'm hearing today that the breakdown of vaccines will be per capita, point final, that's it. So there's no 15% top up for provinces who have bigger Indigenous communities. Can you just please clarify very specifically what is happening with that? And Ontario, for example, has already said all of its vaccines are going to long-term care and healthcare workers. So if it's only through the provinces, then Ontario has already said it seems to not be going to Indigenous communities.
Just to restate what I've said previously, the envelope is there in terms of, the 6 million doses, Pfizer, Moderna. What I think is still in play is, quote, the ratio that each individual province will receive. The territories have indicated their preference to receive their allocation of the total of the 6 million doses, 100% Moderna product, no Pfizer product. And so in terms of good collaboration, the provinces have accepted in principle that yes, that means they will have to take on, in terms of their allocation on a per capita basis, a larger proportion of the Pfizer product. How that then rolls out, and certainly I think that some of the discussion that's going right now is that, okay, even within a given province, based on, I could say, on their Indigenous population, some communities up north, there's also maybe a desire that for some of those communities that it makes sense, obviously, to make sure that their proportion of Moderna product goes to those communities. So as Major General Fortin and others have indicated, that's where you get into the sticky details, I might say, in terms of... No, the envelope's the envelope. There's 6 million doses. So I'm not aware of where we're getting additional doses from when that's the only envelope that we have to work with as sort of a planning assumption, unless Major General Fortin would add to that.
Yeah, I guess what I would add is if we could take a step back here for a second. There's a number of contingencies. There's a number of options that are always available. I'll give you an example. Yesterday I spoke with, over the last 2 days, I spoke with my counterparts in Yukon, Northwest Territories, and Nunavut, Mr. Foster, Mrs. Falk, Dr. Patterson. who are also in numerous other discussions. And we discussed readiness, points of delivery in their territories, their realities about the distribution moving forward, lining up, so they have the ancillary equipment, they have the freezers in their possession or they're being installed. And they are lining up the right healthcare professionals to administer the vaccines at the right time as it becomes available. So the question is, well, how many are we going to get? Well, how many sites do you have? And when are we going to get them? Well, I don't know when we're going to get them exactly, but here's a range of options. And what if we had X many thousand? What if we had X many thousand? So we're able to, in line with a previous comment about trying to go less often to a particular community or location so that we reduce the risk of bringing COVID and we increase the risk of being able to deliver efficiently in the realities of weather and distances and so on and so forth. So if one was to tally the total number of doses coming up at a said time, and you started getting bits and parcels of information and added up and say, well, this particular area has a higher percentage. Well, maybe in that particular instance, that particular shipment, they get a higher percentage of their allocation that's based on the per capita, crunching numbers per capita, and then they get less in the next shipment so that we move on to the next place. So it's not a shell game, but it's a complicated game of making sure that we do this as efficiently as possible, rapidly and safely, and we'll continue to adjust. And as we get more data from the manufacturer, we might realize that okay, we can actually transport it this way. We can actually have it on frozen or thawed state longer. So. As we learn more, we'll share more, and it will illuminate the distribution plan.
Thank you very much, Major General Fortin. That will be all for today's technical briefing. C'est ce qui met fin au briefing technique pour aujourd'hui. Bonne journée.
Participation.